agreements if any of the agencies at the table and among the audience are interested in collaborating with you, that there exists such an option for them. And I want to remind the audience to please complete, if you have questions, to fill up in the index cards, and Kara will be coming around to collect those questions. I'm going to have the last 10 minutes for answering some of those questions, but please do know that we'll answer all those questions in the follow-up email also. I want to go through all of the audience, the panelists here. If you can quickly, in 1 or 2 minutes, 1 minute preferably, tell us what is the missing, after all is said and done, the panel discussions, the afternoon sessions, we all go home. What do you think is the missing link or the missing piece of the puzzle in combating asthma to improve health outcomes for our residents? And I want each one of you to answer that question. What is the missing piece of the puzzle? Christina.
Let me just start first since I'm
Yes.
on the end. So I think, so each of us is going to name what the missing piece is, and what the important part is to note how we can get together and then put those pieces together. And I think we already understand that each of us has their own piece, and that we know and that we're motivated to work together so that we can fill them all in, because there's been lots of pieces that have been said that I haven't even thought about because it's not in my area. So at least in terms of research, I think it's definitely identifying where the gaps are in the knowledge that we have and trying to figure out how to fill them. And filling them is going to be a long process of having these coalitions and discussing what kind of studies are going to inform those research questions, and then designing them and carrying them out. Which is difficult from the point of view of the researcher, because we apply for grants and get funding, and then we can do something. Actually being in a coalition and figuring out what questions we need to answer isn't something that's usually funded. So that's starting to be the case more and more, but it's really important to realize also of the challenges that each of us face in answering that question. And that's what it is from my point of view.
It's like a question of what's the answer to world peace. So for me, I'm actually really excited because with some of the requirements with the Affordable Care Act, and especially in information technology, meaningful use, patient engagement, whether we want to or not, it doesn't matter if you're a patient or a provider or where you are administratively, we're being nudged towards greater engagement, greater collaboration, information sharing, that sort of thing. As far as the missing piece, I think it's a matter of, it's not the missing piece, it's actually connecting the pieces. And for me, I like data, and I'm all about like, so what? I think there's a lot of information out there, there's a lot of data out there, but it doesn't always answer the so what. And that's where this movement towards informatics and data analysis of big data, which is like, you know, big systems, and then this little data that Sarah actually alluded to, which is patient-generated data. And so the missing piece is actually marrying that patient-generated data, that claims data, and that clinical data.
Janetta.
I think for me is what the passings represent, because we're talking about all the algorithms at a 30,000-foot view, but dealing it and honing it right into families who've been affected adversely by the lack of continuity of care, and to constantly remind everybody based on the senseless deaths that occur that this is a real problem that Commissioner Darnell discussed as it relates to disparities. You know, and just because you come from a resource-rich community doesn't mean that your health literacy, as Sarah described, supports that you come from a resource-rich community. So we need to take, my request is that you reach out to me, you reach out to Richard, and figure out how you're going to get involved in this grassroots movement. We keep talking about we don't have resources. Everybody in this room is a resource. we take this information, not just have it as insight, but we convert the insight into action. We do something about a very reasonable problem that can be prevented. So that to me is the missing link, the grassroots effort. Thank you.
I think everybody up here today has talked about, and you bring up this great point about connecting the dots, and we've talked about communicating with data. And for me, I would just take it one step further and say unity. I think being united is how you keep this movement going, and taking our unity, which creates a power, and then applying it in action steps every day. So again, as Danella said, every person in here is the resource, is the answer, is the action. And together, if we take steps to get to know the person sitting next to you, exchange information, follow up, continue to get together in this fashion, that is how we create the change. So I would say unity.
A coalition is the coming together of people who perhaps have a variety of dispersed interests in doing other things, but certain parts of their world overlap. And what we're looking for in the coalition is to bring those people together for that portion of their business that can influence asthmatics. We believe that most of the people who will receive information, many of the families who will receive information will act on it. We also understand, we're not so naive to not believe that there are some self-interest happening in the world, and there's some hidden agendas and other kinds of things that can derail efforts that we're trying to do in terms of getting information out to the community. But it's my belief that the biggest problem that we face, despite all of those things, are people who understand and know this information, but choose not to act on it for whatever reason that they choose to do. I'm reminded of an old Native American expression that it's very difficult to wake people up who are only pretending to be asleep.
Well, I don't see any missing pieces. I think this coalition represents the institutions and agencies and individuals that are needed in order to achieve the outcome that we all share, and that is to reduce the incidence, morbidity of asthma. You have community people in this coalition. One of them is from my district. You have research folks, you have educators, you have all of the major institutions represented, universities. But just as we've heard, each one of us is a resource person. And I think that if we understand what the goal is, and that's to have some impact on those numbers, I see it as quantitative. And we're becoming more and more quantitative every day. Do I see a reduction in the number? Do I see a reduction in the number of children from my district that go to grading for asthma emergency? That's what I have to go by. I strongly support one of the strategies that I heard one of the panelists say. We've got to be more effective dealing with the target population. You know, I often tell people if you have some weaknesses in that area, maybe you should be working at Lockheed on planes. Because you don't have to develop any communication with them whatsoever. So go to work, get your plane and go to work. When you deal with people, the people who've been marginalized, and people who have some challenges in adjustment. As somebody said, irrespective of income, literacy is not just what I think somebody said. Health literacy is not restricted to third graders, the lack of it. I think as a strategy, I support that very strongly. We're talking about families and people. And public health historically specializes in that. Educating, teaching prevention. But recently our health department told us about 5 years ago that in addition to the traditional public health strategies, we've got to look at the total environment in which people live. They told us it's just not enough to do the brochures and the literature. And that's why we put housing and jobs, training and placement in our $1 million health center out here in Adamsville. Not just WIC, but jobs and housing, because the person who comes with that WIC is a total person with a lot of different needs. So I don't see the missing link. I learn every time I come around the health services folks. I learned a lot today. Our Office of Environmental Justice staff person is here this morning. She keeps the information coming to us. And so I don't see it a missing puzzle. I just think we have to get down to business, be committed, and understand that the only legitimate test of what we're doing is quantitative.
Great. Sarah?
I'll try to keep this brief. I just wanted to touch on a phrase that Nazira uses quite often, which is connecting the dots, and just stress once again the disconnect of tracking what's going on with your child from a month-to-month basis, a year-to-year basis, when you're dealing with children who have asthma for years. And you know, it's a great idea, I think, to have parents journal, bring printouts from your pharmacy to show how much you've been refilling your rescue meds, or you know, point out, have a discussion about how long you've been on this preventative medication. Why are you still on it? Why is it not working? If it's not working, why are you still on it? And tracking, unfortunately, the death rates would be a huge help. When I first came to this summit 2 years ago, after making the phone call to Nazira, when I read the article in the newspaper about her asthma coalition, and I met Kellen Molden's mother, Rhonda, I had to thank her for having a bill passed in Georgia that allowed my children, both of my children, carry their inhalers to school, keeping it in their backpacks, keeping one in the nurse's clinic, so that we had one at all times. There was one at school. When I picked them up, there was one in their backpacks, so if we went to after school activities, we always had one. I had one in my purse. But unfortunately, the death of Kellen allowed Brennan and my son Dalton to carry their inhalers to class, to school, and to go to their nurse clinic and say, my chest is tight, or I'm wheezed, or I feel like I need to use my inhaler. So I really had to thank her for taking on that mission, having something accomplished. And again, for Tim and I, you know, we want to take on a mission for Brennan, because unfortunately, her death has gone unnoticed by a lot. Asthma doesn't discriminate. It doesn't care where you live. It doesn't care what hospital you show up in. And you know, we found that out the most unfortunate way. And you know, we just want to see better tracking in place as far as medications, doctor visits, you know, just the entire package, just connecting all the dots when you have a child who has chronic asthma.
if it's missing, but needs to be on the forefront, and that is people being mindful of when you are communicating. And this is not to suggest talking down to people, but just be mindful of the fact of the literacy level. That's just real simple. I mean, I'm challenged with some literacy issues around finance or my car, or it's no brainer. So when you're talking to people, particularly around trying to manage chronic illness, just be mindful of the words that you're using. I heard particular, allergens, bronchospasm. Those are many multiple syllable words. There's a great website called Ask Me 3. Just Google it. And it's a National Patient Safety Foundation that put this out. And it's designed to improve communication, encourage patients to be more active, and to improve health outcomes. And they boil down 3 main questions that you should ask. What is my problem? What do I need to do? And why is it hard for me to do it? I love when Lynn said, when students show up in the health services, and they ask them to show the nurses, how are they managing their asthma? Every moment that you have with someone is a data moment. You don't need a large sample. You just need to capitalize on that opportunity to say, okay, are we communicating here? That's incredible rich data, because at that particular moment, that could impact an understanding of how they're managing their asthma. It can improve their health outcomes, and it reduces costs. It improves relationships. It makes the patient more confident, more comfortable. And so, again, I think the only missing piece is to be mindful of health literacy.
Lynn.
Well, I have so much to say. I could have done this conference all by myself in the 4 hours, and I just had so much to say, and I'm going to try to wrap it up as succinctly as I can. Let me just say this. I agree so much with Commissioner Darnell. I don't think that it's so much of a missing pieces issue as it's a big puzzle that's scattered, and we just need to continue to put the pieces together. Because the pieces are there, the resources are there, the knowledge is there, the talent is there. Every day we learn something new, so we can always bring those pieces to the table, but there's a lot of stuff that we already know. There's a lot of things that we already have. And from the school system standpoint, let me just say this. Sometimes we have a very, we have this perspective that school nurses sit in clinics and give out Band-Aids. It's so much more than that. It is so much more complicated now than that, because our children have so many more complicated illnesses and health issues than that. We see the faces of a Brennan every day, and we take those beautiful faces very, very seriously, and we take our jobs very, very seriously. So part of the puzzle that I think that the pieces that we bring as a school district is, number one, that we take care of these kids every day. And we do it to the best of our ability. But what does that entail? That entails us to make sure that as school nurses, we're prepared and we know where these resources are. So when we talk about missing pieces or pieces that need to come together, there's continued dialogue that needs to happen regarding where the resources are. When I look at some of our data, and yes, school nurses track data, I can tell you exactly for the last 10 years that I've been in this position, how many children we have with asthma in our school district, how many doses of medications we give to these children, what types of medications that they're on. And so when I look at my data, I know exactly where our children, where our highest population of kids who have asthma, where they live. And Commissioner Darnell is absolutely right. Most of our cases are in that South Fulton lower area, almost to Douglasville. So what have we done as school nurses? We partnered with other resources and people outside of our school district. We don't just stay in the clinics in the schools. We go outside of the Fulton County school wall. And I'll give you a real example about, what was it, Richard, about 3 weeks ago? Richard actually came to my staff meeting because I make sure my nurses are kept abreast about particulates, data, information. How can we help our children that are in our school system? So one of the missing pieces, and I want to make sure I get everything, is just pure access to care. When I think about my children in South Fulton, the nearest children's hospital is Hughes Fulton. Many of my families that live in South Fulton are on public transportation. That's very difficult to get to Hughes Fulton. If we go even further south, the nearest hospital is Piedmont Fayette. We don't even have a children's hospital in South Fulton. So we have to come, again, that's a barrier, that's an opportunity for improvement. The other one is partnerships and relationships. We make sure, my school nurses and I, that we establish these partnerships. So again, we're not just in the clinic. And again, thinking about that area that we have so many kids who have asthma, we did programs this year. We partnered with the American Lung Association. And I'm proud to say my school nurse who worked on that initiative is here today in the audience. Wave your hand, Ms. Hicks. She spent hours, weeks coordinating a program for her children, for her families, with the American Lung Association so that we can bring additional programs and services to children in the community. The third thing is continued education. I have a master's degree in nursing, but I learned so much this morning. Just information that was reiterated, that was good information that we can take back to our parents. Remembering things like literacy rate, remembering things like the black box warning, that I can remind my parents to say, even though you get this box, we're going over this information, it's really, really important for you to ask the pharmacist questions about such and such. And if you need some help, come back and we'll try to help you, again, to the best of our ability to explain that information. So from our standpoint, I just want to leave on this note that for the school district, we're here to support this effort. We're here to take care of the children to the best of our ability. But we too are one of the partners in this link, and we certainly want to be a partner in the link. So if there are things that the community thinks and feels that we can do better in the school system, I am always a phone call away. Our information is on the website. Send me an email. Give me a phone call and say, Ms. Meadows, I think I have this program. We'd love to partner with Fulton County Schools to do this. Or here's some information that I think would be helpful for your school nurses. I would appreciate that. So thank you.
Great insight, Lenny.
I'll echo. I agree with the panels in terms of some of the missing pieces. From my experience, I think the missing piece that we have is just sheer awareness. And before the Atlanta Housing Authority, I actually worked for CDC, and most of my assignments were in Africa. And what I've noticed is that CDC does a very good job mobilizing overseas. For example, there's something called NIDS, National Immunization Days, when you take your children and they are vaccinated from polio and measles. But it's more than just vaccination overseas. There's also an educational element as well. We do not see that educational element here. And my point is, why are people overseas are mobilizing and learning about chronic diseases in these impoverished societies, and here in the developed world, we are struggling and mobilizing? So is it a federal government issue? Is it a community issue? I think it's a combination of both. So I think the missing piece is simply awareness, information sessions. Back in 2008, I lost my dad to pancreatic cancer. Happened very quickly. But I'm not seeing awareness sessions. I'm not seeing information sessions regarding pancreatic cancer, which is probably the most lethal cancer. In other words, we don't know much about it. People die, and it's one of those cancers that we're trying to maybe do more in terms of research, but what have we done in the last 10 years about pancreatic cancer? So my point is, I think there's lots of gaps in our healthcare system, period. And I think we can learn a lot from working with EPA, for example, and also CDC. What are their strategies in mobilizing people overseas when they have the National Immunization Days in Kenya, for example, in August? And then September and October, you have so many people who come and they want to be educated. We don't see the same effects here in the States. So I think, from my point of view, and this is based on my experiences, it's awareness, community outreach, information sessions, And the whole educational component, I think, is missing. And it's unfortunate, but I think we have a lot more work to do than we have done.
Thank you so much, panelists, for all these, either the missing pieces or we have the pieces together and how do we put together. Please know that Carla is actually recording this session, so you will have a video, a CD out of this session. So Commissioner Donald, you're not going to miss any notes. You'll have the video version of this panel discussion. We'll just go through quickly a couple of questions, and then the lunch is also ready outside. So Andrea from the State Department asks a question: does the Asthma Coalition collaborate with the colleges and universities, because looks like the students are well controlled at their homes, but when they come to the college, they don't have the control over the environment inside, the humidity and the air quality. So does the coalition collaborate with the colleges in Atlanta and around Atlanta?
So for those of you who are still probably trying to figure out what the FAIR Coalition has been doing for the last 2 years, probably capacity building is the word I would use to describe it. And Naziris gave a great question: do we collaborate? We're actually in the process of collaborating with Georgia State University with some grants around capacity and also gathering data to support strategic initiatives. I think Commissioner Darnell talked about in terms of quantitative information, but qualitative pieces of information both are needed to support a strategy, and the strategy has to be based on the greatest return on the investment. And I don't mean profits, I mean being very strategic, identifying who do you need to work with to design a model that would support the outcomes, the best outcomes in the most accelerated fashion. So to answer your question, yes, we are, and more of what that project looks like will come out as we grow and cultivate relationships.
And I guess this question is directed towards Richard. Are there any respiratory therapists involved in your coalition in teaching asthma education?
Yes, there are. We have one of the original founders of the Asthma Coalition was from Georgia State, who was in the pulmonary group there with a number of respiratory therapists. We have Dr. Galena, who's now retired from Emory, who has brought us to the attention of a number of the people there. And in fact, Dr. Galena is working, I believe, with Sarah here to set up a program whereby those children that are most at risk will be able to go into their homes, with their permission certainly, to go into their homes and do an evaluation of their indoor environment and find out what kinds of things are affecting them that can be tied back to the pulmonary group that they can help. And I wanted to make one point about that. When we're talking about the emergency care and the method and the numbers of emergency situations that exist, we don't have to solve all of the problems or eliminate all the triggers for asthma, for emergency room visits or for serious asthma attacks. It's kind of like filling a bucket up with water. You get some from your food, you get some from outdoor, some from indoor and all that, and the bucket overflows. If you can remove any of those things from your environment and reduce the load on your immune system is far better able to handle the rest of it. So we don't have to solve everything in order to make a significant difference in that component of emergency care.
I think I'd add to that, again, about strategy and being very targeted. Christina related, you talked about indoor air and understanding exactly what the cause of the reaction or the asthma attack. I don't want to say the word exacerbation, who would know that, right? But we have to be very strategic, and I think if we identify the triggers, the causes of those triggers very specifically for that particular patient that deals with asthma, we're more likely to improve the health outcomes. And we gotta think about it from a global perspective, but then drilling it down very specifically. We already know the targeted audience, what's needed and what's necessary for that community to support improved outcomes. The other piece to this is we need community involvement. You have all these alleged experts here, you know, outside of Sarah and Tim. We need someone involved on the panel, Varnell, to be able to provide feedback exactly what's going on in their communities based on the beltway that they're dealing with on a day-to-day basis. That's key.
Great point. Thank you so much. And I guess the coalition is made up of the community members, researchers, and healthcare providers coming together to create solutions and a forum to make things happen, right? So we do have all your questions. We're going to make sure that we answer all of these questions when we send up a follow-up email. And I'm directing Kara, my team member, to make sure that we have them all answered and we send out the email. And you heard it all, folks, today. Again, we might not have it all solved or resolved today, but we are here. We are talking. We started the dialogue. Atlanta Housing Authority was not there 2 years ago, but now we have their attention and they have ours. And collaboration partnerships are very rewarding, and especially if the overarching goal is centered around patient-centered improvement outcomes, health improvement outcomes. That's the ultimate that we received. So there are 4 sessions in the afternoon. We hope you would stay and attend these sessions. One of them is by Richard. He's going to focus on indoor air. And other one is how do you get access to data presentation by the Morehouse team. And for those who have family members with asthma, there's a team presenting on the inhalers and spacers and the new device techniques that is available to manage asthma. Apart from that, lunch is served outside. If you can go through this door, the door here towards me, and then come back to the other door to the back, that'll be great. So thank you so much for being here attentively, and I hope you enjoy your lunch. And we do have our panelists, they'll stick around for a few minutes in case you have more questions to be answered. Thanks so much again.